off, the University of Arizona is looking at ways to end racial inequity in health care for people of color. 9 on your side, Chandrea Thomas has more on what steps they're taking to solve this issue right now. Chandrea?
Yeah, Pat, it is a major issue, and it's been an issue that's been plaguing the Black community for generations. And while there have been some progress, it's still clear that we still have a very long way to go.
We all need to build this environment where diversity can thrive.
The legacy and issue of racism in healthcare for Black patients in America has always been a pressing issue that has a big impact on if or when someone goes in for critical care.
Studies confirm that patients cared for by someone who looks like them tend to be more compliant with the process of care.
Dr. Victoria Moraine is the Vice Dean for Diversity, Equity, and Inclusion at the U of A College of Medicine in Tucson. She says about 38% of students currently enrolled are students of color.
We also find that a more diverse group tends to be more creative in their solutions.
Scholarships and recruiting efforts are also key to drawing them in. 150 high school students are invited to campus every year to streamline the process.
The efforts have to begin much earlier in the pipeline. We need to encourage our children to recognize that there is no obstacle too great to keep them from becoming who they want to be.
And the biggest issue is trust. This picture posted at the University of Arizona Medical School Museum in Phoenix from the 1840s shows doctors preparing to operate on an enslaved woman without her consent or anesthesia. It's just one on a list of tragic and horrific medical experiments performed on Black people that left families with trauma, a lack of confidence, and a lingering fear of the healthcare system. And they're not alone.
The historical traumas certainly affects the Black population, also affects multiple other populations of color. Native American populations have had to deal with this. Hispanic, Latinx populations have had to deal with this.
Dr. Moraine says the university is working on new ways to bridge the gap. In 2020, efforts to attract students of color was spurred in the midst of unrest over racial inequality and systemic racism. White Coats for Black Lives chapters were formed, and students of all races got involved.
Based on all the social unrest that was going on nationally, our students were very much the activist group and said we cannot continue to do things as usual.
They also have 10 anti-racism themes that students follow throughout their education. Transparency, engagement, and accountability are just a few.
Each of those themes now looks at specific goals.
And the doctor has some advice if you're worried about taking a trip to the doctor.
Have your questions written out or take that person with you who can help you ask the questions that are important to you.
Chandrea Thomas, KGUN 9 on your side.
And Chandrea will rejoin us in just a moment. Mistrust in the healthcare system runs deep for Black Americans. Henrietta Lacks' family knows that firsthand. They're suing biotech company Thermo Fisher Scientific for profiting from the relatives' cells. You may know of Henrietta Lacks. She's the woman whose cells were used for medical advancement, including the development of vaccines and cancer research. Her tissue was taken when she was diagnosed with cervical cancer at Johns Hopkins back in 1951. She died a few months later, but her cells lived on, growing outside her body. It was the first time that had ever happened. Since then, HeLa cells have contributed to cancer and pharmaceutical research. They were even used to develop the polio and COVID-19 vaccines.
If you take a medicine, or if you put your makeup on in the morning, or you shaving in the morning, or whatever, my grandmother's cells have been a part of that development of making that product that you're using. And a lot of people don't know that.
Well, doctors took her cells and used them for research without her knowledge. Her family didn't even know until years later. They say they're very proud of what their grandmother's cells have done and will do, but don't think it's fair. Big companies are replicating and profiting off her tissue.
This fight should be over. Another generation of Lacks should not have to go to fight for their grandmother or their family's legacy to get what is rightfully theirs.
Well, that company, Thermo Fisher Scientific, made a huge profit of duplicating and selling her cells, but her family hasn't made a dime off of that. Chandrea rejoins us, and Chandrea, it's just another example of the mistrust that people of color have for the medical community at some point.
Absolutely, Pat. And I think aside from the historical things that have happened, there's a lot of misinformation as well as a lot of information about things. I know people in my family and friends who won't get vaccinated because they don't trust the medical care system. I've had experiences where I've had to question things twice and get a second or third opinion about things. So I think at the end of the day, it's a matter of listening to what the doctor said. Take a list and take someone with you who can actually help you ask those questions.
And your family doctor's best because you have a relationship with
Absolutely.
them.
And go by references, I think so too.
Yeah, good idea. Thank you, Chandrea.
Yep.